we anticipate to have a bigger number. I am just informed that some of us are just breaking the fast now. We are sorry about that. We did not remember to factor that in. Next time we shall. So please pardon us for interfering with your calendar and your fast. And thank you for the sacrifice for those that have been able to log in already. And we do hope the rest are going to log in soon after. So welcome to our second webinar series. We are extremely excited to keep this running. Remember, we began last quarter and we did agree that we are going to have a webinar every quarter. And we said that we are going to have different regions leading these webinars. So in the first webinar, we had East Africa. And in this second webinar series, we have Southern Africa. And we are very pleased to have Rehana representing our Southern African region. Just before Rehana makes her presentation, I would like to share a slide just to remind you the context in which today's presentation is going to be made. If you remember our previous presentation, we did share with you a highlight of the model that we're using in Africa to translate evidence into practice through university-based academic programs. And we did say that we have a model that works through 6 steps. In the first step, we identify university faculty that are interested. We then conduct UTCs and UPCs to disseminate them to this faculty. And in the third step, we do a needs assessment of universities for program development, after which we build capacity of the faculty to develop academic programs. And of course, we move on to implementation of these programs and eventually evaluate their impact in terms of translating evidence into practice. And therefore, today, we are very privileged to have Dr. Rehana Kader take us through this third step of needs assessment for program development. We are excited because this is not just another presentation. It is a presentation that is based on their own experience from South Africa. And therefore, there's so much for us to learn from the rest of Africa, from what they have done in South Africa specifically. And once we learn that, then we hope we can actually implement this in our regions, in our countries, and in our universities. Without wasting much time, therefore, I wish to introduce our presenter, Dr. Rehana Kader, who's going to actually take us through a beautiful presentation about how you can do a needs assessment as a university or as universities to prepare for development of academic programs. Dr. Rehana is not new to us. I'm sure many of us have met her. She's actually our secretary to the ICUDDR Africa. At the same time, she's a board member of ICUDDR Global. Dr. Rehana is also a global master trainer with both Colombo Plan and UNODC. She's trained in the areas of UPC, UTC, and also the child curriculum. We are very excited, Rehana, to have you share with us your experiences of the work that you have done in South Africa and Southern Africa. So on behalf of all of us, let us welcome Rehana. So take it up. Thank you.
Thanks, Beatrice, for the introduction. And I must say, I'm really excited that we are actually on the third phase of our strategic plan. And also, I would like to just thank all the attendees for showing up today. It's really heartwarming, especially since it's the month of Ramadan and a lot of Muslim people are going to be breaking fast right now. So we appreciate that you made the time to come. I'm going to share my screen now. Okay, Beatrice, is that, can everyone see the screen?
Yes, if you make it a little bigger.
Perfect.
Thank you.
Okay, lovely. So what I'm going to be presenting on today is, as Beatrice mentioned, the third step in our plan in terms of implementing an addiction science curriculum in the African continent. So what we did as South Africa is we did a needs assessment of the entire country and all the universities in the country to find out what are the needs of these universities in terms of wanting to implement a curriculum. And I'm going to walk you through the process that we implemented or took place. So I'll give you a very brief background and introduction, and we'll speak about the aim and vision and the objectives of the study. I'll walk you through the methodology, the results, the conclusions, and the recommendations. So as you would see, I think it's on my left-hand side where there's this road with little, I think, little signs or signpost which states that if we are looking at wanting to develop some kind of a curriculum at a university or a higher institute, there's a process that needs to be followed. And the very start of the process would be to first conduct a needs assessment of these universities to find out what are the requirements before we actually start looking at the curriculum and before we start implementing it, and finally in terms of evaluation and feedback. So initially we did a kind of research to see what's exactly happening in the country, and I think as in all countries, there's a high prevalence of substance use. But what research indicated in South Africa was that although there is such a high prevalence, treatment rates still seem to be quite low. Many people are not receiving treatment. And one of the main or major factors for this lack of accessing of treatment was that there was a realization that we do not have enough expertise among professionals, especially in substance use disorders. The research indicated that in South Africa, professionals that have been trained very generically on substance use. And when I talk about professionals here, it's specifically related to the medical professional or psychiatrist, where they do a very short module, which is based on the DSM-4 diagnosis, under which substance use disorders fall. And that's just about where the training stops. So clearly what we found out that there definitely is a need to upskill and for us to implement a substance use addictions curriculum. And we're better to start than starting to implement this at university levels so that we get to train all professionals that would exit the university with some expertise and competencies in substance use or in addiction science. And a core mission of ICUDDR is to ensure that we have a very professionalized workforce in addictions, which can effectively and competently help people that most need our services. And those are people who have substance use disorders and related conditions. So just a brief background. The brainchild of ICUDDR was founded in 2016, headed by Mikhail Mayovsky, who is the president of ICUDDR. And in 2019, we had a meeting in Addis Ababa where the African continent ICUDDR was established, with all the different regions establishing their own ICUDDRs with countries as well. So since 2019, the African continent has been quite active in the involvement of trying to install or implement an addictions curriculum. One of the priorities that came out again from this meeting was we need to do a needs assessment. If we don't do a needs assessment, we're not going to know what are the needs of the universities. And obviously, if we have an idea of what the needs are at these academic institutes, this will definitely inform the implementation of the curriculum that we would want to develop. So mainly this presentation would look at what was the formal needs assessment that we did and what did we look at. We looked at the current addiction science curriculum that is available in South Africa. We also wanted to get a sense of the perception of academics or staff if there is a need for an addiction science curriculum. Furthermore, we wanted to get a sense from them, would they be interested in a certification of a multidisciplinary professionals accreditation? So not only psychologists, social workers having accreditation as addiction professionals, but transdisciplinary across the different professionals. And finally, how feasible would it be for us to implement something in the country, and would universities be open to this? Specifically looking at ICUDDR, which offers the Universal Treatment Curriculum, which we call UTC, and the Universal Prevention Curriculum, which we call the UPC. So basically, this is just a snapshot of what we wanted to know from the universities in South Africa. So firstly, in terms of methods, we looked at the landscape and we looked at our country. And as you can see at the map, we have 9 provinces in South Africa. And each province has universities. So we looked at the 9 provinces, we looked at the amount of universities in these provinces, and there's a total of 25 public universities in the country. Although we have 25 public universities, only 19 of these universities offer some sort of behavioral health sciences. The other 6 universities are technical universities. So we sent out a survey to these 19 universities across the country. And what was so impressive and phenomenal about the survey was that of the 19 universities, 17 universities completed the survey. So we actually had an 89% response rate for a survey that was done electronically. And I'm sure most of you that have conducted research know how difficult it is to get people to complete surveys. How did we collect the data? We used a structured 33-item electronic survey where some of the team members of ICUDDR in South Africa developed the software package, and we emailed it to the different respondents in the different universities. Our survey was guided by the implementation guide that was developed by ICUDDR, and it is available on the website, which actually guides academics and universities from the beginning of from the beginning of assessing the needs of a university to implementing to evaluating. So it's a very detailed document in guiding university staff in terms of how to implement an addiction science program. Some of the questions that we asked in the survey was, for example, do you know if your university offers any training in substance use or addiction science? If yes, please indicate, do you have a course? Do you have a module? Do you have a degree? Do you offer a diploma or any other options? Then we asked, what would be some of the objectives of wanting a curriculum in substance use? Okay. We also asked them, if they have to implement a curriculum, what would be some of the gaps and challenges that they experience? And how can we help to overcome these gaps and challenges? We also asked a question of what are the core strengths of the programs that they offer so that maybe we can build on the strengths of the university or the existing curriculum. We also asked questions about if they have existing multidisciplinary teams, so whether psychiatrists are trained, whether criminologists are trained, so across the disciplines. Another important question for us to know in terms of wanting to implement a curriculum was, does the university or department have the capacity? If they don't have the capacity, it's going to be difficult. So we wanted to know, what kind of support would universities need? Okay. I'm going to skip through most of it. More importantly, we also asked in a needs assessment, are the universities open for resources to be offered by ICUDDR and the support that ICUDDR is willing to give to these universities in terms of the UTC and the UPC, and whether they will be willing to utilize this curriculum. So let's go into the results in terms of what were the responses to the survey. So these are the provinces in the country, and we received a total of 37 responses. Now note the 37 are not 37 universities, because only 19 universities, only 17 universities responded, but we had responses across disciplines. So for example, if you look at the Western Cape, that's the province where I am based, and the rest of the ICUDDR ZEC from South Africa. And we have only 3 universities in the Western Cape, but we had 15 responses because different departments responded to the survey. But the overwhelming responses was from the psychology department. So for example, the question was, in your academic departments, in which addiction science training is offered? And as I mentioned, psychology was the main department where they had some form of an addiction science curriculum. So if we look at the universities that said that they have some kind of addiction science curriculum, this was more in the form of either a short course or a module or a seminar that's embedded in the overall teaching. So it wasn't the core focus of the training. We also have the postgraduate diploma in addictions, but there's only 2 universities in South Africa that offer this, which is the University of Cape Town and the University of Stellenbosch, where the entire focus of the diploma is purely based on addiction science. So how did they respond to the question of what were some of the gaps and challenges in the current program? Interestingly enough, people responded by saying that they do not have sufficiently qualified academics who have up-to-date knowledge and skills in terms of SUDs. The staff members do not have sufficient training opportunities, so there's no opportunity to upskill themselves. Again, SUDs is not a core focus, like I mentioned, but it's just subsumed into the existing programs. And I think a very important challenge that we have in the country, and I think in most other African countries, is that we do not have a certified addiction registration. So professionals might do, for example, the program that we have in the postgraduate diploma in addictions. They complete this entire year, but it does not lead to an addiction professional registration. So that's something that we need to work on. We also realize that treatment just focuses on, teaching focuses on treatment, prevention, and aftercare. Professionals are very generically trained, but we don't address topics such as harm reduction, medication-assisted treatment, or HIV and TB and co-occurring disorders that are all linked and related conditions to substance use disorders. And then we ask the question, so what's your university's capacity if we have to implement such a program? Some universities said that they do have some capacity, and the capacity that they do have was around registered clinical psychologists who have some foundational knowledge of SUDs. A challenge would be in terms of capacity that staff have full workloads, so they're not able to take on additional work. We're short-staffed, and I think like all countries, budget and resources and finances is always a challenge. And again, what kept coming up in the needs analysis was that we need to upskill the trained professional people. And we need to shift the focus from medical and clinical work to the other areas of substance use disorders. What was positive was that there's a keen interest in wanting to implement addiction science. And yes, we had an overwhelming response of 95% of the respondents saying that they're ready and they're willing and they're open to receive guidance from ICUDDR. So for us, I think this was quite encouraging and motivating and inspiring to know that our country is ready to implement such a program. And then we wanted to know, so what would be your objectives? You know, why would you want to implement such a program? So majority indicated again, they want to implement such a program so that it can provide an overview of addiction models to the people that they're training. The objective would be to introduce addiction counseling theories to students. We want to introduce assessment, treatment, and prevention of SUDs, and to provide a standardized curriculum across the country, because we don't have a standardized curriculum. And again, I think this fits in perfectly with the global vision and mission of ICUDDR, where we actually want to introduce a standardized global curriculum so that we all speak the same language and we all work from an evidence-based practice point of view. The question was, so if you require help from ICUDDR, what would be some of the things that you want us in terms of collaboration with ICUDDR? Primarily, or the predominant response was that we need whatever support that we can get, but these are the 5 or 6 responses that was, or the choices that we gave them on the survey was: most wanted to develop or build on the existing programs and improve that. Secondly, they would require help from ICUDDR in developing new substance abuse programs, also in enhancing staff teaching capabilities, and to encourage research collaboration across continents, across Africa, but also globally and internationally. So would you benefit from the UTC and UPC? And again, you can see the overwhelming majority of universities were absolutely in agreement that they would definitely benefit from the UTC and the UPC curriculum. So what would be the target audience? The next question was, who would be your potential candidates that you would like to train? And interestingly, we found that 29 of the responses was that the first candidates that they would want to train would be the existing professionals, and then postgraduate students, and then undergrad students and non-degree professionals. And when we looked and analyzed the qualitative data, it only made sense that if we do not upskill the existing staff, they will not then be able to teach the students. So it did make sense that our first point of entry is that we need to upskill the existing academic staff. We asked what would be some of the core competencies that we need to look at. And the responses were theories of addiction, being taught how to use screening and assessment tools, to be introduced to evidence-based counseling, which includes also looking at interventions, prevention, aftercare, but not only in the individual, but the family and the groups and community. And like I mentioned, understanding substance abuse in relation to the broader context of other health issues that we experience. So in asking the question, what knowledge, skills, and attitudes you would want in terms of core competencies, skills was the majority of the response. People need the skills to be able to help people with substance use disorders. So that was a very quick snapshot of what our needs analysis results had shown us. Obviously, it's quite an intensive document, but I thought today I would just give you a very brief overview of what we have collected. We're in the process of writing up a paper which would give you a more detailed understanding of the needs assessment. But in conclusion, I would like to say what has come out very clearly from the survey is that there definitely is a need for an addiction science curriculum. The climate is right in our countries, universities are ready, and the government also realizes that SUD is a huge problem, so it needs to be addressed. What was good is that we already had a walkthrough in our country, and most of the universities that attended, not most, in fact, all the universities that attended the walkthrough have now started implementing parts of the UTC and the UPC. So South African universities are ready for the implementation. And I think it's a very, very exciting time for us that we have come so far in our work since 2016. I would like to acknowledge the team that had worked behind the scenes in terms of making the survey a possibility. We had Mr. Fergus Ashburn, who's our country coordinator, and he was brilliant in terms of getting the whole survey into a software package that actually, once you send it electronically, it actually analyzes your data and it gives you all the beautiful graphs that I showed you. So you don't need to be a statistician, or you don't need to have, expert knowledge in being able to do this kind of survey. Warren Cornelius helped in terms of getting people on board and getting the universities, and so did Lemise. And we realized that it has to be a team effort, and we all are not skilled in everything. And then we asked Professor Nadine Harker from the Alcohol and Drug Abuse Unit in the MRC to help us with the data analysis, so that to make sure that we have a good product at the end of the day. So in conclusion, I want to say that where we're going to go from here is that the needs assessment, it would be great to see it to be replicated at other universities in the rest of the continent. And that's the reason, I think, and one of the objectives for today's webinar, so that we can see how we can work collectively and perhaps make this a reality in the other regions of Africa, and see what we come up with and how we can work collectively together. So thank you for listening to me, and that's the end of my presentation, and I will hand over to Beatrice for any of the questions and answers.
Thank you. Thank you very much, Rehana. I don't know whether there's a place for reactions. If not, yes, I'm looking for them. I honestly can't see it, like I said, but yes, I see it. So give a reaction to Rehana from your side, if you have it. Trying to see whether I can get mine. Yes, there you go. So thank you very much, Rehana, and everyone else give an emoji to appreciate Rehana. It was a great presentation, Rehana, and very deep, actually. I have taken a couple of notes and reflections, and I have also observed that you have tried to highlight as many things as you possibly could in a pretty short time. Thank you for sharing with us the context in which you began thinking about this needs assessment, and even telling us where we were coming from as ICUDDR. Thank you for sharing about the methodology that you used, which is very helpful, so that if anybody wants to replicate, then they know where to begin. Thank you also for sharing with us, very interesting, some of the questions that you put in the needs assessment survey, because that then helps us in terms of setting up our own, if we are interested or if we want to use this. I have particularly liked something that came out about the core competencies and the fact that they came out so well. And one of the things that I think is very powerful about this tool that you used is that every one of us in our countries can actually use it and get sufficient data that can support the development of a program. One of the key challenges in developing an academic program is to ask yourself, what does the market require? So with this kind of a tool, it gets to be so much easier because then you're coming from a point of information. You're informed by the potential employers of the graduates you will graduate from the program. And therefore, it's an extremely comprehensive tool that I do hope every one of us can actually use rather than reinvent the wheel. I now would like to open the floor. I have actually seen a couple of questions in the chat, and I'm going to begin by reading the first one by Fatima. Thank you, Fatima Abiola. Your first question was about how many universities are implementing addiction science programs and why are others not implementing? Do you think it is a policy issue? So maybe you can respond to that, Rehana. Thank you.
So, Fatima, I don't think it's a policy issue as much as is people are not skilled and do not have the expertise in the area of implementation of substance use programs. And I think for many universities, it wasn't highlighted the importance of substance use in the broader sense of health professionals and public health care in the country. And since we started with the ICUDDR and we've been reaching out to universities, more and more universities are starting to realize that it's all integrated. You can't see substance abuse separate from other health issues. So you can't train a doctor or a psychologist or a social worker without addressing substance use. So I think that's one of the reasons why some universities have not started a program, whereas other universities, some of the academic staff had some exposure to substance use, and hence they started implementing substance use programs. So not as much as a policy, as much as the upskilling and the training and the expertise that's required in the country.
Thank you, Rehana, for that. And that just begins to make me think how much we can do in terms of sharing expertise. You shared with us the people that helped you with your needs assessment. And I think I wrote down here, I hope Southern Africa is willing to help export that expertise to other regions. And thank you for saying yes. And so a good number of these issues of expertise and limitations, I think together through ICUDDR, we can share this expertise. Thank you, Rehana. I have a second question from Radwa. And they're asking, or she's asking, have you done any assessment of impact in terms of improvement of services delivered for those that have gone through an addiction science course? Have you done any assessment of impact on bettering services delivered by those that have been through the program?
It's interesting that you asked that question, Raja, because, like I said, we have different universities to just be in a course or a module or a seminar. So there hasn't really been like a core course besides the two universities in Cape Town that offer the postgraduate diploma in addictions. And the coordinator perhaps of the course previously, she has started her master's. Well, not actually, she's actually completing her master's, and that's exactly what the topic is looking at the impact of such a curriculum that was delivered and what impact did it have on its students, and did it lead to any improvement in workforce, or did it open more opportunities for them? So the question that you're asking, Raja, is actually part of the implementation guide of ICUDDR, because we are going to evaluate our courses at the end of the training to see what kind of impact it would have, which is a very important part of curriculum development.
Thank you very much, Rehana. And actually, Dr. Fargas in the chat is also helping you answer that question. and he
Yes.
says about Shahima, who's
Yes.
actually from University of Cape Town and is doing a research, a mixed methods to assess the
Yeah.
postgraduate diploma to see the impact it has. And I am actually quite interested in that. So I will be reaching out to
Mm.
yourself to connect me with Shahima because I would like to use the tools
Mm.
to actually assess the impact of our program. If you remember, we said that the epics of our model is that we really want to check whether there is
Mm.
impact. So we do
Mm.
see that already some of us in Africa are looking at that, and we would like to borrow and also continue to do that for those that already have
Yeah.
programs in
Yeah.
place. And she's
And
actually right there, and she shared her
yes.
email. Thank you. I will be reaching
Yes.
out.
Yeah.
So
So
we have another
Shahima,
question.
sorry, Beatrice, Fergus
Yes,
is the convener of the postgraduate diploma in addictions at UCT, and Shahima also started there. So if they want to also answer some of the questions, I'm happy for them to give the input now if they would like to.
lovely. Lovely. Thank you for that. And that's the essence of ICUDDR. We want to connect people, we want to connect ideas, we want to connect experiences, and we want to connect expertise. So thank you very much, Shahima. One more question from Radwa is, no, from Lahija. Do you have any standardized curriculum? What steps are you having to get the postgraduate diploma recognized by council? I think you did say that recognition is an issue. And so the question is, do you have any, standardized curriculum? And do you have any ideas on the steps that you're going to take as a region or as a country to get this diploma recognized by council?
Mm.
Rehana.
In fact, Fergus and I just had a meeting yesterday. So, what we've done is we have developed what's called a working group uh, in terms of formulating a document that we can send to our accreditation body, which is called the Health Professional Council of South Africa. And we actually have the chairperson of psychology as part of our working group from this council to help us develop a document with core competencies and looking at how we can apply for accreditation, but using the course that Shahima and Fergus are involved in, the addictions diploma, as our basis and as a stepping stone to say, look, we've already have an existing program, we want registration. How do we go about it? So we've started that process as well.
Thank you very much. Again, a lot to learn from there. I remember a couple of years back in my country, our regulator started something they were calling credit accumulation transfer in terms of how can we make sure that every program in a certain discipline has the minimum requirement. You can always add your own, but the minimum, so that we can standardize and ensure that if you're moving from a university in Uganda to a university in South Africa to do the same program,
Mm,
then it's likely to be similar. And
yeah.
so I'm thinking that that's part of what we have to do. We have to ask ourselves, what are these core competencies? What are these minimum standards? What are the minimum courses that must be offered in a program that is claiming to be an addiction science program? So I think these are things we need to discuss and continue engaging even as a region, even as you do the work group. Maybe we need to do regional work groups. Maybe we need to do
Mm,
African work groups
yeah.
to explore this. So thank you for that. There's another question from Fatima from West Africa. How many professionals have you trained so far, and how many more do you plan to train?
Mm, mm.
Yes.
Shahima, would you be able to answer that question in terms, Shahima and Fergus, in terms of UCT? How many people have been trained through the course?
Yes, I see an answer in the chat. She
Mm.
says that the diploma has trained 120 professionals. That's excellent.
Mm.
You could also tell us how many more you plan to train. 1,000, 1,000. That's ambitious. All the best. Thank you very much. We have another question, Rehana, from Amari, I think, Amani. Did you use any other questionnaire other than what you shared? How did you determine the sample size in terms of the number of universities and the number of participants?
Mm. So we used this particular survey based on the ICUDDR implementation guide, and we also did research in terms of other needs assessment, and it seemed to have the same common questions and objectives in terms of what a needs assessment survey requires. How did we do our sampling? The first thing that we did was we just looked at our country and we looked at how many universities we had. And then it was just a snowballing effect where we just sent emails to all the universities. We targeted key people that we may have had personal relationships with or people that we knew. We followed up with phone calls. We followed up with Zoom meetings because you must remember this started in 2019 and then COVID hit in 2020. So it actually worked in our favor because we had a lot of Zoom meetings to build up the relationship. So our methodology was based more, strangely enough, in terms of the relationships that you develop with people. So, for example, I know Beatrice, and I will contact Beatrice and say, Beatrice, you at Kenyatta University, who do you know that would be able to fill in this form? And then Beatrice will send it to that person, and then that person will send it to somebody else. And that was the success in terms of us getting all the universities. So it wasn't random sampling, it was purposeful sampling where we purposefully tried to get all the universities in the country.
Thank you. Thank you, Rehana, for that. An interesting question from Michael. How did you get the funding for this needs assessment?
Michael, thank you. You know, that was at the back of my mind and I forgot. And do you know, that's the beauty of this whole thing. We had absolutely no funding. And this entire survey was done because of the passion of Shaima, of Fergus, of Lamise, of Warren. They were the key people, and they all used their own spare time to get this whole thing rolling. So, amongst just the small team of people, we managed to get the survey done without any funding. So, and I think that's a big thing that we always think that for research we need money and we need funding. And this small team, just because they're so passionate about what they do, they drove the entire process.
Thank you very much. I think what you're saying, Rehana, is that the biggest funding is passion.
Absolutely. And the survey is free. You know, you get it. Fergus and Shaima will help you guys with that. You know, we're open to helping each other. And, you know, it doesn't cost anything to send an email and complete a survey. So, yeah.
Lovely. Thank you very much. And that's again the spirit of ICUDDR. We may not
Mm.
have the money in terms of money, but we have funding in terms of kind. You know, we talk about cash or kind. So in kind, there's a lot of resource that we can get right from this network that we have. So thank you very much. The next one is a comment from Uganda by Godfrey. He says that in Uganda, when a curriculum is being developed, there's a question on career and employment and where the graduates fit within the public service. And he's wondering whether you have similar issues in South Africa.
So I think we're working on a parallel process. So we're looking at the addiction curriculum and developing addiction professionals, but at the same time we're also looking at the workforce. And I think this is also part of Shahima's thesis, to look at, you know, all the people that have been trained, what kind of work did they get. So for us to start forming relationships with treatment centers, with NGOs, with other places, with rehab centers, to ensure that there is a space. But then again, if we go back to my introduction, and the research indicates that there is a need, you know, there's a high need for these skilled professionals. So there is a space for them to fit in. I hope I'm answering your question, though. Yeah.
I think you have really tried to answer that question, Rehana. And really, it's just to say that you can't wake up and develop an academic program without an idea about the market, about the field. And so thank you, because part of what I saw in your in your needs assessment, some of the questions, some of the tools were actually working towards that. And I think the next thing is to ask ourselves, as we are doing this needs assessment and we are thinking about the universities, we could also go beyond the universities to think about bringing on board some of the potential employment sectors that would also have some interest. So one could build it a little more so that you also hear from the potential employment agencies, the potential market, what they think about having graduates in this area. Thank you very much. We have a comment from Rania. This is not a question. She says that in North Africa this year, they are interested in doing a needs assessment, and therefore they're going to use these steps. Very, very useful. Thank you very much. Now, a comment from Helen from Nigeria. Thank you, Helen. I know it was a struggle to get in, and you're right here. Helen says there's only one postgraduate diploma she's aware of in Nigeria, in the Niger Delta University. And I am reminded that Brian has always challenged us to make sure that within Africa, at least we have a minimum of one institution in every country that is offering an addiction science program. And the question I have for all of us is, if we can reflect on our countries, if we can reflect on our institutions, if someone wanted to do an addiction science program, is there somewhere they can do it within the country? If not, what kind of steps are you willing to take now that you're part of this great team to make it happen in your own country? And the message is that what Rehana has given us is a beautiful starting point in terms of looking at the needs that are in your country, looking at the needs that are in your regions, so that you can use that to begin to build the capacity of your institution to actually develop a program. Thank you for that. Now, I see a question from Morekwe, and this one I am going to actually request her to speak because she has used acronyms that only a few of us can understand. She asked, do you have the NCQF for the Envision program with SAQA? That one is like Greek for some of us. But I suppose that Rehana, you understand the acronyms because you're from the South and Morekwe is from the South. So you can interpret them for us as you answer that question.
Yeah. So I think the NQF is the National Qualifications something, I can't remember. And the SAQA is also about qualifications assurance. So when we're looking at developing an academic program for registration, part of the requirements would be that they need to meet a certain level of expertise or competencies that they need to meet. And Beatrice, you come from the university, so you know that X amount of credits are needed for a course to be at a certain level. So if I am understanding Morekwe correctly, so it's looking at registration is a very complicated process. So you would have to look at the accreditation levels, the qualification levels, at which level they are, how many credits there are for an honors course compared to a master's course, compared to a first year level. So all those needs to be taken into consideration. So we'll have to still work with those bodies as well. So it's like you have to work with different quality assurance, accreditation bodies, etc. And I think it makes sense because at the end of the day, you want to know that you can trust the professional person that you're going to because they meet all the requirements, of the competencies for a professional in addictions. Yeah.
Thank you. Thank you very much, Morekwe. And I see some contribution from Dr. Fagas to Morekwe. I think that is very helpful as well. The NQF level for the PG DIP is 8. It's the equivalent to a graduate honors degree. And I think this is really about asking ourselves, when we develop programs, we must reflect on the statutory requirements for the programs. I think that's what university education is about. And so for every country, there is a requirement for every program. And it is important that every one of us is aware of that so that when we develop programs, we do not get into problems with the qualifications authority within our countries. And because people would like to graduate and have their certificates recognized by these bodies, then we need to be in touch with what it is that they require. Otherwise, Dr. Rehana, it has been great and very enriching, and we have learned a lot. And I just want to sum up a few from myself of the thoughts that I just thought about. Dr. Rehana says that they are willing to share with us this tool for free, and that's really important. And thank you very much. We have also understood there's quite some expertise from South Africa that would be willing to support the rest of us in our regions to conduct this needs assessment. At the same time, we are free to take it and adapt it and possibly broaden it to meet the needs that we have in our specific context. And that's really what ICUDDR is about. I want to thank every one of us. I see a little comment here at the end. Does the student pay their education, or is it covered by the university? Someone from Nigeria called Kehinde says, I'm aware of professional masters in addiction in another university, and that's to say that there could be more than the one that Helen thought about. About whether students pay, we're going to hear that from Rehana. From Adayomfo, can you please give an idea of the qualifications of the lecturers for your postgraduate diploma in addiction? I think you answered those two final questions, Rehana, whether students pay for their education or government covers. And finally,
Fergus has just responded to those questions.
Absolutely, yeah, that it's self-funded, yeah, just like in our country. And I think this is important because, which tells us why the needs assessment is important, because the students are going to pay fees for themselves. If they're going to pay fees for themselves, then there must be value for their money. And so making sure that what we develop meets the needs of the potential customers, meets the needs of the potential employers, will then attract students to join the programs. Give an idea of qualifications of the lecturers for the program. Yeah, the lecturers are mostly clinical psychologists and psychiatrists. Thank you very much. And I think we shall end it there. Dr. Rehana's email, please put it in the chat, Rehana, so that if anybody would like to give further questions, they are free to contact you and we shall keep reaching out to you. Now, Samuel, who's the mobilizer of our webinars, is reminding me to ask all of us to turn on our cameras because he would like to take a beautiful photo of your smile. And as we do that, I am now very glad to inform you that in the house, besides all of us members, we had a representation from ICUDDR, led by Kevin, the director, Kerry, the deputy director, and Olivia, who has actually been supporting us in setting up this meeting, and we are very thankful to that office. I would therefore like to invite Kevin to give him about 3 minutes to speak to us. Thank you, Kevin, for finding time. Take it up.
Oh, thank you. You were all working late in the evening or late in the afternoon and obviously breaking fast, etc. It is really great to see this group and I want to thank the team that put this together and all the participants that came. Clearly what we heard today was really a strategic framework to achieve the development of addiction studies programs or courses. And in that strategic framework, at least as I heard Rehana speaking and the conversation and the dialogue taking place in the chat, et cetera, is really a 4-stage process with multiple sub-stages. But the big one is obviously a needs assessment to understand where you are now, where you are at a given point, and then developing sort of an action plan of what we need to do based on that data and based on that information. So we're data driven, and then implementing that action plan, whether it's through in-kind funding, as we heard about how this particular needs assessment was done. And then we also heard about evaluation and review of the progress that was made based on your action plan and the outcomes for the students and the outcomes for the program itself. Rehana mentioned a particular guide that's on our website called the Implementation Guide, which is once you know what you want to do, once you have an understanding of the courses you want to have, and they've also, you heard today about the Universal Treatment Curriculum, Universal Prevention Curriculum. There's also the Universal Recovery Curriculum to deal with that component as well. That you have free access to and can manipulate and adapt, because of course nothing is perfect. And for even within the African continent, it has to be adapted to the country context. But I'd also like you to think about one other thing that really was being discussed, but we didn't really focus too much on it. And that is really developing or creating an enabling environment both within the ministries of education, to within the universities themselves, to be able to offer a diploma or a degree, whichever level, undergraduate or graduate level. So there's some work that needs to be done on enabling environments and trying to measure where are you in your country context in that enabling environment. So if you go to the Ministry of Education or first to your university rectors and deans, et cetera, saying you'd like to do this program, what's their, how much of an argument are you going to get or pushback are you going to get? Are they going to already adopt the idea and accept that idea? Because even if we do the best needs assessment and everybody agrees in terms of the faculty, but we don't have the leadership, then we have a non-starter, if you will. I'll stop there because I know it's getting close to the end of your time. It's a pleasure to see you all, and hopefully I look forward to working more closely with you all. Remember that we're having our global meeting in Chiang Mai, and some of you are already on the panelists. Some of you have submitted abstracts. The registration for the actual meeting will open up soon. And I look forward to seeing you there or seeing you virtually in these types of meetings. So thank you again, Rehana, for a great presentation. Thank you again, Beatrice, for pulling this together, and for everyone who actually contributed to the data. And again, I can't emphasize more what was said by Rehana and by Beatrice. It's really about the networking, the sharing of information, that we can get things done easily, potentially, put that easily in quotes, but at least can move us along with shared vision and a shared understanding. Thank you.
Thank you very much, Kevin, and it's a pleasure having you as always, supporting our initiatives. I want to thank the Vice Chair of ICUDDR as well, Martin, who's here and part of the team. We actually have a little team that plans these webinars, and we have Martin in there. We have got Rehana there. We have got Samuel there, Dakwak, and we have got the regional coordinator. So if we're planning for a South African conversation, then we bring in the leader from South Africa. And we are very eager next quarter to listen to North Africa. So Dr. Rania will be on board and steering this process alongside this implementation team. I would like to request that you turn on your cameras because Samuel and Olivia would really like to see your smile as they take this photo, so that they can have this as evidence and that we had this great seminar. So kindly turn on your videos for just 1 minute. So from me is to really, on behalf of the team that has organized this, to express our deep gratitude to you, the team that organized, the members. There was a lot of communication in the WhatsApp group. There was a lot of reminders by Samuel. How many days to go? There was a countdown actually running all the time, including just about to begin. I think the final one was we have begun, so you must log in if you haven't. So thank you for that mobilization. Thank you to the members for actively engaging us when you couldn't be able to register or log in and making it happen. I know that from here, many good things are going to happen. I believe many of us are going to begin to do the needs assessments in our regions. Those of us who already have programs, I can assure you, we're going to network and begin to evaluate impact. based on what we've learned from this. And I think one more important thing we're going to be having to do is to think about pulling together, to think about the core competencies that we need for this standardized program. And of course, what Kevin just said, the importance of thinking about how to create enabling environments back home, back in our universities and our countries to ensure that things are running well. So thank you very much. I'm waiting for Olivia and Samuel to tell me that the photo is taken and that I can end this meeting. So once they tell me,
Okay.
Samuel, Olivia, you're done?
I'll count you down.
Lovely. Thank you very much. So to all of us is to wish you well, and to those that are Muslims, we wish you a lovely Ramadan. Sorry we interfered with your breaking of the fast. We will not do that again. We will be better informed next time. And so we look forward to meeting you in the next quarter to have North Africa, and the final quarter, we're going to have West Africa. So thank you and bye-bye.
Thank you.